What's going on, guys? Welcome back to the Move Local podcast, brought to you by The Movement. My name's Dalton, and I'm coming at you guys with another episode this week. Thank you for tuning in. If you aren't subscribed to the podcast, make sure you head over to your podcast platform and subscribe so you don't miss out on any of our new episodes. And you can head over to our Instagram page, move.local, to see clips of the show. We're doing our best to get some video content this year, so you can keep on the lookout for that. But today, I'm super excited to be sitting down with Carly Crawford. She is the owner of Collaborative Clinical Practice. She's a psychotherapist, and we're going to dive into mental health and psychotherapy and some of the awesome things she's doing over here at her business. So, Carly, welcome to the show.
Thanks for having me.
How's your day been so far?
Pretty good.
Yeah.
Yeah.
Telling me it was
Mondays.
a little bit of a weird Monday for you.
Yes, it is a bit of a weird Monday, but that's okay. Mondays are usually a really long day for me, so it's nice to have a bit of a break in the schedule.
Yeah.
Yeah.
Get to have a conversation about all the things that you do.
Yeah, and the weekend was great.
Yeah.
Because of the sun. We got to see the sun.
I know. It's gone now today as we sit here and record this, but it was very nice to have that.
This is kind of our norm, right?
I know.
Yeah.
But yeah, I would love to maybe kick it off with like your kind of journey into the profession of psychotherapy. I think that'd be really great to like set the context, and then we can dive into like your business and like all the stuff that you guys do.
Yeah, so I was reflecting on this question this morning, and I think my answer has probably changed over time, which might seem a little bit bizarre, but reflecting on it this morning, I think I've always been the type of person that knew I wanted to do something very in the field of nurturing and caring. I thought I was going to be an early childhood educator. I started off working in daycares, and then it was early experience in my undergrad where one of my professors really took me under his wing. I was a health studies major and didn't know what I wanted to do, and opened me into the world of mental health. What I used to always say was that it was my personal experience with mental illness and being a patient in our mental health care system. I think that it's definitely a combination of the two things. So that brought me into the field to start doing work from a volunteer standpoint, and then to get to this position where working as a private one-on-one private practice psychotherapist. I started off in the not-for-profit world, so working at a resource, being the executive director of a eating disorder resource support center, and I think that through that experience, really recognizing the need to have more one-on-one care with that population, and then experiencing the barriers to getting funding for mental health services and everything that we went through as a not-for-profit. I started doing private practice on the side, and then after I had my first child in 2011, I just continued on with doing private practice on my own at the time. So your question was, how did I get to this point? It's a very good question.
But I think like it's interesting. The journey into it is very similar to my journey into physio, and I think a lot of people and can relate maybe to you saying like, oh, I experienced what it was like to go through the system of dealing with mental health and probably interacting with therapists and that kind of thing. Like similar on my front is I had interacted with physiotherapists, which is kind of what ended up having an influence on driving me to learning more about the profession. And then from my perspective, I always saw that there's plenty of opportunities to utilize a lot of the skills that I would like in a job through the platform of physiotherapy. And that became like what drove me into like working into physio and getting in there eventually. So it seems very similar in that sense of like utilizing the service and then realizing it's something that you wanted to contribute to. And then I find like once you get into something like this, at least from my perspective, it was always like, okay, well, what can I do to maybe add more to the profession and improve the way that we deliver care or access to care or whatever it may be?
I think for those of us in the mental health field, we will say that it's not always necessarily a good experience that led us to wanting to do this, but the lack of care that was available. So that's a pretty poignant thing in my experience with my challenges that I faced from a mental health standpoint was that there wasn't any care. So that was a big driving force in the original not-for-profit that we had. It was a completely barrier-free, no wait list, no cost, no referral needed. So having that be something that, wanting to create that space for people to be able to come, which is kind of what we're doing here too.
Yeah, for sure. And I think that access to care is probably something that continues to be a challenge in today's day and age. I would say it's and this is me from an outside perspective, because I don't really know a lot of the details around it. I would imagine it's better than it's been, but there's still room for improvement in terms of being able to have people access care, would be my guess.
Yes, and we could do a whole other podcast on that. I think, unfortunately, there's probably more available care if you have the financial access. So it seems like there's a lot more private therapists kind of, but in terms of accessing care through our hospital system or health, it's
a bit of
probably worse. Yeah, since COVID.
For sure. Yeah. And I guess what I'd want to start with the conversation too is I know there's a lot of different access to different types of therapy. So there's psychologists, there's psychotherapists, there's different terms for it, right? So I'd be curious to hear from your perspective what you do as a psychotherapist, what would you define that as, and how do you approach your care and working with people? Yeah. So
the controlled active psychotherapy, a lot of people would be surprised to hear that it actually wasn't regulated until 2015, which is kind of terrifying for some of us that have been doing this for a while. But basically, psychotherapy is a type of talk therapy that what we're doing is we're really looking to have there's a very defined kind of beginning and an end to the session. What we work to is we're meeting the client where they're at and probably helping individuals everywhere from people that have a diagnosis that has been given not by us, but from a trained professional that can do that, to folks that want to come into psychotherapy that are honestly dealing with day-to-day stressors, right? So psychotherapists are trained in different modalities that range in a whole bunch of different styles, and many of us would be trained in a couple different modalities, or there are therapists that would be strictly a DBT therapist, for example. So all of us here, and myself included, tend to draw from different philosophies and different backgrounds in terms of our modalities and what we actually do with our clients. But psychotherapy is really about, coming in and being able to recognize the value of working through some of the things that are going on in your day-to-day life. So looking at that can be what's happening right now. Some of that is a bit of psychoanalysis, looking at things that have happened in the past. But what we find is that we're really helping individuals to draw the connections between how outside stressors are impacting our day-to-day, our mood, our physical health, our relationships, pretty much all aspects, right?
Yeah, and I think that it's interesting to see all the underlying factors that get influenced by those types of struggles, like you're saying, your physical health, your relationships. You don't even realize that these things are being impacted until you start to reflect on them, and sometimes it's hard to reflect on your own, so having guidance from someone to have that conversation with, I see how that would be extremely beneficial to finding some type of solution or pulling on some type of thread that can guide you towards controlling those things or managing those things.
So I think a lot of people think that it's about, you book an appointment and you come in and you talk about your problems and then we tell you how to fix it, which is not the case. So we are very much about, I should say I am very much about empowering our clients to kind of recognize their strengths and kind of meeting the clients where they are, and perhaps being able to offer some insight in drawing some of those connections for them, right?
Yeah, it's interesting because I'm obviously a healthcare professional and I work with people, and I think there's a lot of crossover between what physical health can do for mental health can do for physical health. There's like so much relation to that. And even for me, someone who personally knows the benefit of psychology and like those types of modalities, like it took me so long to step into accessing that care for a lot of those reasons that you talked about. And there's a lot of like, even for someone who knows, there's some misconceptions around like what it is like to actually do therapy, and it was like something that really opened my eyes when I finally did like step into that realm. When it came to like identifying some things that you talked about in terms of like reflecting back and how's that impacting you now, and some of the decision making things that you're doing in your life today. So it's a very powerful thing when you step into it, but I imagine the barriers to getting there is like what's the most challenging for a lot of people.
And there's so many barriers.
Yeah. I'd be curious, is there like some, I know this is like a wide ranging thing because there's so many different populations that you're probably seeing and whatnot, but like what are some of the common barriers that you hear or that people probably are going through when it comes to like taking that step to accessing therapy, outside of, let's say, maybe like the financial barrier that we know is something that can influence that? Maybe more of some of like the mental barriers that people might be experiencing, or stigmas around therapy.
Totally. Good question. I think the biggest, there is still a lot of misconceptions, right, about what mental health is and what mental illness looks like and what this space, what we do here. So I think that even understanding when you say you're talking to a friend and you're like, you know what, maybe you should talk to someone, like it sounds like you're going through a really hard time. What that looks like, I don't think people understand because we don't really talk about it, right? So it's not necessarily something, we tend to work kind of in our own little silos, which I think is a huge problem, but that's why like connecting with other healthcare professionals so that we can have this kind of collaborative to say, okay, like, do you understand what happens in this space and why it's beneficial for the healing of the pain in your body or whatever the case may be. So I think that there's a lot of misconceptions. It's just not something that's talked about. I think there still is a lot of shame that's associated with needing help and being able to recognize the value, which brings me to, I think, time, right? So we see a lot of folks that, to take the time to recognize that they need help takes time to actually physically be able to get here for your appointment, right? I think that people don't necessarily realize that, you can come to one appointment, which is great, like taking your first step, but chances are you're going to need to keep coming, and so, which I'm sure is similar to physio. So there's a big barriers, and then as you said, like different demographics, different populations, there's different barriers, right?
Yeah, for sure. And I like the idea about time, because that time between like maybe going to therapy comes into your mind, between actually making the decision like, okay, I'm going to do therapy, like that time can be very long. Then the time to like, okay, now I know I need to do therapy, now I need to book a session and find the time to come in and do that, like that can be a long process, I'd imagine, for some people. But what I've realized from my own experience is that once you finally come to do that, you realize that like once you get into what it can do for you, all that time that you're worried about investing or the time it took is like, you're most of the time like, oh, I wish I would have prioritized this way more. So it's like this weird thing where we're like, oh, I don't have the time to do this, or I don't, but then once you get into it, you're like, oh wow, this is really helping me. I wish I had done this way sooner. Is my experience with it. Totally.
Like so many other things we do in our life.
Right? Yeah, it's very transferable to like many areas.
So I think with something like this, right, like a lot of us were brought up in generations where you don't talk about stuff and we're just supposed to be able to handle things, and so being able to really truly see the value in that is super challenging. But the time, I think that's one of the things that I'm a little I tend to be quite overprotective is the word that comes to mind, but just this idea, when somebody does take the chance to, or the time to reach out and send us an email that they're interested in coming in for care, we really do our best to get back to that person in a suitable amount of time, and or if we can't take them, we tend to have a wait list here quite often. Connect them to another person, because obviously that is, if that's the first person, if that's the first time that person has reached out, if you don't hear back for another couple weeks, we're a lot less likely to hear back from that person.
Totally. And there's a lot of I always say this with our clients and with the clinicians that work for us, is it's a very vulnerable thing to ask for help, to reach out, even if it's just reaching out via email. For us, we do a lot of phone calls. We have people walk in, we have people come in for initial assessment, and I always remind them how vulnerable that is to stand out and ask for help, and to make sure that you really we do everything we can to value that decision that they made, because I think that goes a very long way when you're treating that time with a lot of respect, because
I agree,
it's challenging.
So we'll often hear, you're the first place to get back to us or whatever, but it's a privilege, right, when somebody is giving you that little bit of insight in terms of what's going on in their life.
So when it comes to maybe someone wanting to access working with you or your team here, what does that process look like for anyone that would be interested in working with therapists? How does that go? What's that journey look like?
So I think every clinic does things a little bit differently. What we find works is we ask individuals to fill out a little bit of a questionnaire that just gives us a little bit of insight in terms of which therapist will be probably equipped with the right amount of experience and skills to be able to help them. And then they have the opportunity to have a free phone call or a video call with the therapist, just to chat and give a little bit of a chance to ask questions, a chance for the therapist to explain a little bit more about what they do. A lot of the research will show that I can have 1,000 letters behind my name, but it's your connection with the therapist that is going to be the biggest predictor of you feeling some relief. And then, because we're at a position right now where we do have lots of practitioners that work here, this is a really hard thing for people, but if after your first session you're not feeling something felt off, we do really encourage people, you can try somebody else here. I think that's a really hard thing for people to do, because we live in a society of people pleasers, but that is a really important thing that I tell people all of the time, that okay, if it didn't feel right, your first therapy session is probably going to be really challenging, but keep trying. We're all different. We all approach this work a little bit differently, and finding that person that feels most comfortable is important.
That connection piece is so key, and we value that a lot as clinicians in physiotherapy, and I could imagine it's even more enhanced with what you guys are doing, and I think it's so important. And that was one thing that I always appreciated with the therapist that I had sat down with, was hey, if this isn't a good fit for you, and you're not feeling this makes sense, then we can find you someone, or we can refer you somewhere that might make more sense. But the most important thing is that you're feeling comfortable with the interactions that you're having. So
absolutely, which is great, and I'm glad to hear that other people are encouraging that, because I think it's I hear a lot of people, I think I hear that a lot more so in my personal life, but friends or family members that will say, I tried and it didn't feel good.
I tried physio, or I tried therapy.
And you're okay, well, try again.
No, and I it's funny, I just posted on Instagram about this, on my own Instagram, because I think it's something that's super important, and I really try to remind all my clients, or people in my life, it's there's someone out there that can help you, and can continue to push to find that person. And it's I hope we get to a point where we have more clinicians out there that can continue to align with people, but there is someone out there that's willing to work well with you and get alongside you and help you and take you that way.
Agree.
As much as it's easy to just say don't give up, it's really important that you continue to try to pursue finding someone that can support you and your goals.
Totally, because I think especially in this line of work, or just being a human, we tend to be really hard on ourselves, and so there might be some inner dialogue around, well, I didn't do therapy right, or I didn't, I must have been doing something wrong because it didn't help. And it's no, that's not the case. It's okay to identify that you didn't feel comfortable with this or that, or that something made it seem like it would be hard for you to keep trying, right?
Yeah. And I would imagine like there's so much layers to us as humans and like the experiences that we have and the things that we're going through, that it might just take time to like uncover what that is. And like the one thing that I really appreciated from the therapist that I worked with, and it really shifted my mind around working with a therapist, was I always had this fear that like when I would go in to see a therapist, that it would just be like opening Pandora's box and like all of my deepest, darkest like things would come flying out and I wouldn't know how to manage them. I wouldn't know how to handle them. Yes. So I was very scared of that. And I remember telling her this, and she told me that like, your body will let these things come out as they're ready, and it's not just going to come flying out of there all at once. And like when you're ready to have those things show themselves, or we get to it, it will come. And it really put me at ease, because that was like one of my biggest fears, and it's something that I've continued to like think about, and I've mentioned it to other people because I feel like that's a barrier sometimes, or something that people are fearful of. And I think to our point here is that, you know, if it didn't work the first time, or you didn't get to that end result the first time, it's like continuing to pull on that thread and unravel what is underneath that, because there might be more to it that eventually will put the whole story together and will make sense, right?
Yeah, absolutely. And I think that brings up, you know, just, you know, maybe some important conversations about what, you know, what is to be expected when you're in this space. And I think there's a certain amount of discomfort that you can feel when you're here, and it's nerve-wracking to come in. I think that I would always want people to have the ability to, you know, mention that in session, just as you said, like these are the things that I'm worried about. These are the things that I think are going to be harder for me. And then being able to work with a therapist that can explain. A big part of the controlled active psychotherapy is really ensuring that your client understands the why behind any sort of intervention. So that consent piece around, okay, so this is perhaps what I think we could talk about. How does that feel for you? And I think that that's where that collaboration and seeing that client on the same level versus that fear that I think a lot of people have, which is that you're going to come in here and I'm going to tell you like, okay, we have to do this, this, and this, and this. And that's the only way that you're going to be able to get to whatever, you know, the next thing is in your life kind of a thing. So another misconception, I suppose.
Yeah. For sure. I could see that. I think this kind of maybe ties into an Instagram post that I saw you guys post, and like you might not remember this, but it was something along the lines of saying like, what is scarier, the thought of trying to talk about how hard things are, or living your life wondering if things could be better? And I was curious to like chat a little bit about that, because like it like resonated with me, like the quote, and I was just wondering like if there was anything that, you know, you would elaborate like further on that thought about like what is scarier, the thought of trying to talk about how hard things will be, or living your life wondering if things could be better. And I think it's that idea of like, for me anyway, when I read this, it was like that, it's that idea of like taking that step and having the courage to like go and ask for help and face the challenge of that, versus like also what would be hard is if you live your life wondering about the fact that could this be better, you know?
Yeah, exactly. So I think it was really, I write all of the Instagram posts. It's just a chance for me to rant about whatever I'm feeling at the moment. So I think that it's really, you know, trying to help people to normalize this process again, and also just, you know, some feelings that I was having, or that I have ongoing, of, you know, seeing people that are suffering. This is more in my personal circles, right? Obviously the people that are coming in here are making the steps that need to be done. And just feeling a huge amount of empathy with understanding how hard it can be, but just wishing that it wasn't so misunderstood, right? So recognizing that, yeah, I get it, it's hard, and trust me, I do understand that. And why are we so comfortable with the alternative, which is being in the same day-to-day suffering in some cases,
which is also very hard, right?
Of course,
I think like it comes back to that idea of like, well, they're both really hard in choosing what kind of hard you want to go down, because like it's hard to take that step into going down this like path of trying to figure this out. But it's also really hard to stay in that suffering and or wonder what it would be like to get out of it. And I think there's a lot of similarities to what I do, and it's very hard to be in pain or injured or not doing something that is meaningful to you. And it's also very hard to take a step into the journey of rehab and trying to take control of your health and improve that situation so that you can get back on the path. And I think a lot of people get turned away or don't take that step in because of that perceived hard. But I think it's important to talk about the other hard, which is like, if you don't do that, what is the outcome, right? And that for most of us, like, we're all having challenges in our own way, but most of us are going through something hard that's relatively challenging for us. And like, I think it's a normal thing for a lot of us to go through that, and trying to normalize the fact that, like, yeah, you know, you're struggling, I'm struggling, we're all struggling in some sense. Let's try to figure out how we can like manage this in your own way, right? So it just kind of resonated with me, because I think there's a lot of crossover between like a lot of the barriers I see from people wanting to take a step into rehab as well, with that kind of thought.
Totally. And I think that here and in my professional experience, you know, working with certain populations and certain populations that may be impacted by behaviors that are really kind of impacting their day-to-day life. So whether that's struggling with addiction, substance use and abuse, eating disorders fall into that category, where yes, it's scary to think about leaving some of those things behind. It's scary to think about getting sober. It's scary to think about, you know, challenging the behaviors of your eating disorder, and it is also challenging to stay in where you're at. So I think that sometimes offering those little gentle reminders.
It's so hard, right? Because like, I would imagine from my perspective with this, when I do it from a rehab perspective, is like, I have a lot of like, I think empathy would be the right word for that individual, knowing like can almost feeling what they're going through in some sense, you know, and knowing like from my own personal experience how hard it is to actually go on that journey.
Totally.
And it's like, you want to meet them where they're at and like definitely like make them feel okay about that, but at the same time you're like, okay, how do I help like show you the path, and then we can get alongside each other and try to work together forward. And it's like this ever contrasting challenge as a clinician to do that, you know.
I think you nailed it. I think that's where I always say, so people will ask me, when I first started off in the field, I think that the organization I worked with almost used me as a bit of a poster child, like, oh look, she had that, so like, and look, she's doing better now, kind of a thing. I think that the older I get and the further away from that, you know, talking about my personal experience is not very common, but the fact that I have a personal experience, I don't know how to be a therapist without having that, but I know that it completely impacts that level of empathy. It also impacts, you know, the feelings that you have as a clinician when you see somebody suffering, and you know that you have a bit of a different understanding of what that feels like. And I in some circles, my clients, and you know, I'm fairly well connected with some of the communities, they'll say like, I want to come see you, Carly, because I know you're not gonna put up with any of my shit, and you're gonna be hard on me, which is like not a very good, it's not necessarily what most therapists would want to be known as, but I think that comes from that part of me that recognizes that in some cases that that deeper level of understanding of that struggle. So it's very, it's a balancing act, as you said,
because people are looking for you to help them and push them, and that accountability and that kind of thing. But you also know, as a clinician, when it comes to behavior change and making these things happen, that like you sometimes can't just like be extremely hard, or you have to make it successful in a way that's not going to drive the
long term.
Long term. And so you're balancing those things in your mind while
constantly
trying to make sure that you're, you know, meeting the person where they're at, who's in front of you. So it's a big challenge that I can relate to quite a bit. But I want to touch on the, you know, I think you talked about like the lived experience, and I know that you guys have an upcoming event called Misunderstood, and that's around eating disorders, and I know you're putting that on, and it's around like your lived experience with that. So one, I'd love for you to touch on that in any way that you feel like makes sense.
Okay.
But what I wanted to get to was like, I think there's and I talk about this with like our clinicians at the movement a lot, and I think about it for myself, is like there's a lot of value to having some type of lived experience and helping the people that are in front of you.
Yeah.
And I think it doesn't necessarily have to be like, I have to go through this injury to be able to treat this injury.
Right.
But going through the process of rehab or going through the process of doing something that's very challenging, like let's say addressing some type of mental health issue that you might have for yourself, or going and pursuing something like training for a marathon from our perspective, and like learning like what it's like to go through that process, how it is to like fail on your own, how it is to overcome those mental barriers where you don't want to do things, or learning how you respond to that, I find can be very helpful to offering thoughts and suggestions to people who are going through a process that might not be the exact same, but in a similar fashion.
Totally.
And so like, I think the lived experience is interesting, and I would love to hear like you touch on that a little bit and talk a little bit about what you guys have coming up, because I think there's a lot of value to what you're doing.
Yeah, thank you. I think, lived experience, when you're talking about it in the context of being a therapist, is not something that's always been very well received. And I think when I first started in the field, I'd be sitting around tables and be very ashamed to talk about anything that I experienced. But that's really changed in the mental health world in the last, I'd say, 5 years. So it's I think people are recognizing that our system isn't perfect, and so perhaps some of the treatments and the evidence-based kind of approaches are maybe needing some work, and that we actually need to listen to people and their experiences and kind of use that to help us learn how to help people from a mental health and mental illness standpoint. I think as I just said, kind of in that last bit of information I was sharing, I don't know how to do this work without having a lived experience. It's not like I started and
it's
then
like what thrusted you into the profession.
Exactly, right? So I think that that being said, I think that it definitely, what my clients will say is that, they can just tell that I get it on a different level, right? I don't think that, just an FYI, like if you're sitting in a therapy session and the therapist is talking more about their experience than hearing what you have to say, I would question that. But it's more about things like bigger themes, like understanding what it feels like to be, somebody who didn't understand what was going on with them and really needed somebody to help them to understand kind of why my brain was working in a certain way, or help me to, or understand what it's like to be asking for help and not have any help. And so like there's a lot of different layers that kind of help from a lived experience perspective. And for me, unfortunately, my lived experience really did take me to quite a dark place where things could be very different for me right now, and it extends beyond just my personal experience, but to close friends and close family members and that sort of thing, that I believe really does, I think that it makes me more passionate about this work. Probably leads to the lots of hours that are spent in this space. But it does make it that much more rewarding as well. I think that this event coming up is, you're going to see me look really uncomfortable right now, because it's not something that, basically, I think why we're doing it is two reasons. So back in November or October, I had a speaker come, another local guy. He works at Mohawk. I met him through Good Life, actually. So he is an individual that talks very openly about his experience with suicide and depression. And we were trying to really make, just reduce some of the stigma associated with men coming into the therapy space. And I had approached Nick to ask him to come and speak, and he came and spoke, and it was in honor of one of my best friends who I lost. He died by suicide this summer. And so, thank you. So Nick came and he spoke about his experience, and I sat and I kind of listened, and then a couple of the therapists mentioned that, hey, my client has asked about your experience, and like, so I said, okay, we'll do another thing here. I think that sometimes I take for granted and maybe forget that it could be very helpful for people to listen to somebody talk about like getting to the other side. So that event in particular is just to kind of help, I guess, reduce the stigma and help people kind of understand. I will be talking a bit about kind of some of the things that I experienced. It's Eating Disorder Awareness Month or week, and so part of my diagnosis was having an eating disorder, and I think that that's one of the things that people really don't understand. And so being able to maybe talk a little bit more openly about kind of what that means, and also how that impacts me as a therapist and a individual.
Well, that's awesome.
Yeah.
Well, I appreciate you sharing that, and I think like I think that's going to be a great event. Have you shared that story, like the story that you're sharing at this event? Have you spoken about like your experience to other people before? Or is this more of your first time?
No, good question. So the last I did yes. The answer to your question is yes. But every time I've done it so far, I think that first of all, I think the first time I told my story, like my story wasn't. I think it was way before I was ready. It was probably like 17 years ago.
Right.
And then probably about 6 years ago, for the same reason I was asked to speak and did kind of the same thing. But I definitely am going to do it differently this time. It's crazy how much like getting older and life can just kind of uncover different areas and wanting to kind of explain things from a different perspective. Instead of like, okay, so this is what happened then, and this is what happened then, just more about bigger themes and kind of helping people to understand from that perspective.
Yeah, I think that's really cool, and that's like what I think is so valuable, sharing like your own experiences, and especially if like you're so in this space, like I would imagine that you continue to see ways that you can tell your story or tie your story into helping other people more effectively. And like, I think that's the cool part about that. And I think that it goes a really long way for people to share their perspectives. And I think we as humans underestimate how impactful our own stories can be for other people who are just like us, because we often think that we're nobody and like no one's really going to care about what we say. But like most people in the world are very similar to each other.
Totally.
Right? And so they're going to relate to that. And I think what enhances it, being in the position that you are as like a psychotherapist, is I think the fact that you're telling that story makes it even more powerful, because in the medical world and in the healthcare space, there seems to have been, and there's probably reasons for this hierarchy that's been created to where like you as a psychotherapist, this isn't the case, but you as a psychotherapist put up on this pedestal of like, I'm this perfect person that has no issues, and like you're talking down to this other person who's like struggling so much, when that's obviously not the case. But being able to break that down and like have more relatability between like, you as the therapist and me as the individual seeing you're like, oh, okay, like this makes me feel so much better. I see that a lot in our space as well. And I think it's really important that we continue to make that more on the same level. And I think sharing lived experiences is a great way to do that for people.
Yeah, no, thank you. I think that it's also, you touched on something important. It's not just my story. So yes, this will be my story, and there are definitely aspects of my story that I will never share in this space, but the challenges that I had to face and the way that I was treated in certain circumstances, that they're stories that I hear all the time. And so trying to help people to see, again, kind of what you're saying, that it's not anything that people are doing wrong. And some of these challenges that we're facing when we go to get help for our mental illness are very systemic and are, things that we have to help to educate people about, so that it's not, we hear a lot of, people talking about, feelings of failure, or I guess I wasn't sick enough, or like all of these things because certain diagnoses weren't caught, or, certain professionals didn't take them seriously or whatever the case may be. So it's important to shed some light on that piece as well.
Yeah. That's awesome. When is that event? It's coming up, like it's February. You don't have to, we can put the exact dates if you don't have it, but I know.
It's February 21st.
Yeah, as we record this podcast, it's the start of February, so this episode will probably come out before that event. So check out, I know it's on your website, so check out her the website, which I'll link in the show notes if you guys are interested in learning more about that event. I think it's a cool thing that you're doing.
Yeah, and so all of the money that is raised, I think that it's like $20, the tickets, it sounds so funny. We have, every clinician here has certain spots for sliding scale clients, so individuals that it's just harder for them to be able to afford to come in. So all of the funds that are raised from that will just go towards those spots.
That's awesome.
Yeah.
That's so great.
Yeah.
I guess just to wrap up, the conversation, then we're going to transition into some fun rapid fire questions.
Okay.
And then we'll fully wrap up the podcast.
Okay.
But if there's anyone out there that's like thinking about wanting to utilize therapy and they've been on the fence about it, is there anything that you usually like to like share with people to maybe like encourage them to step out into that realm or something along those lines?
I think that it's important maybe to look at, really ask yourself the why behind it. So that might seem like a very obvious thing, but I think sometimes our initial instinct is just no, like I'm uncomfortable with that. But to really be able to, okay, so what are you afraid of? Are you afraid of are you worried about judgment? Are you, one of the things that we didn't talk about in terms of barriers is having somebody else in your life find out. So having a family member, where are you going? Those sorts of things, that's a barrier as well. So are you afraid of somebody finding out? Is it a safety concern? And I guess, social media is, and I'm sure my algorithm or whatever is, there are so many therapists out there. So, being able to really think about, okay, so is it important for you to see someone older than you, someone younger than you, someone the same gender, and then being able to be willing to look at, doing some intake calls. And then I say this, I work with a lot of people with anxiety, so like you can try, you don't ever have to come back, right? So that's the other thing, right? So it's not like you're signing a mortgage and you have to, come here. That's another thing that we're, if a therapist is doing, we're not allowed to, because like we're not selling you 8 sessions and guaranteeing anything. Most people, I find this especially with men that come in, will say, oh my God, that was not that bad. And they will be like, when can I come back? Usually when they step up. So I guess like just to what we were talking about, I think that therapy is made, there's this perception that it's really scary, and it doesn't need to be, right? And so we do we have coffee, it's comfortable
it's
here, like
it's bright,
trying to make it as, not overwhelming and as possible.
Yeah, right? No, it's great. And I think those are great points. Like the why is so important, always knowing the why, and then finding the right person is a lot of what you talked about then. And then, oftentimes it's not as scary as you think, which is like majority of challenges that we have in our life.
Totally.
Right? But I can relate to why people have the fear of doing it. But
100%. Yeah.
Okay, let's transition to some rapid fire questions.
Okay.
Favorite local coffee shop? One of your favorite local coffee shops.
Okay, but people make fun of me because I like Tim Hortons coffee.
It's okay. There's no hate. There's no hate on. I'm a big coffee fan, but I think like.
But I'm a mulberry person.
Okay. Yeah, they're good.
I don't like strong coffee and like really good coffee. Which there's a lot of really good coffee places
on the street.
Yeah. So there's Smalls. The general store has coffee. Yes. But
my business partner used to say this quote. He's like, all coffee is good coffee, but some coffee is great coffee.
Okay, that makes sense.
So it's like Tim Hortons, cool.
Yeah. I'll tell you a quick rapid fire story about coffee. So all of the therapists that start here, there's been a whole bunch of them. Just I think Sasha and I are the only ones that didn't drink coffee, and then they started here and they got they went on this roller coaster of like being hooked on coffee,
Yeah, yeah.
and then like now everybody's on decaf. So I've ruined coffee for everybody.
Yeah.
But yes, I would say I like my walk to Mulberry.
Yeah, they're
for the
great.
most
It's a
part.
good
Yes.
vibe there.
Yes.
What would be one of like your favorite local like restaurants? I know there's a ton even just on the street, but so maybe, or one of your more recently frequented restaurants that you enjoyed.
My favorite food is French fries.
Okay.
With ketchup, and
Yeah.
Merit Brewing has the best French fries.
Okay.
In anywhere.
I've had Merit's French fries before. They're very good, but I never paid close enough attention.
They're fantastic.
Yeah.
Yes.
They
do give you like fancy dipping sauce, but I just ask for ketchup because I don't need the fanciness.
Yeah, I'm a big ketchup guy.
Me too. So I would say.
Okay. Yeah.
Yes. We've the team and I we've gone. Our last team dinner was at the Mule, and Cowabunga Pizza is fairly new and they're fantastic.
Yeah. You guys are surrounded.
We really are.
It's dangerous being here, I'd imagine.
Yes, and Burnt Tongue is multiple times a week because they're fast and you can.
They have a spot in Dundas, which is where our space is at, and so it's a place we like to go as well.
Yeah, it's a quick walk for us.
What's some of your favorite ways to stay active?
I'm a runner.
Nice.
Yeah. So activity was a bit of a part of my eating disorder.
Yeah.
So part of my recovery over the years has been kind of figuring about a balance, pardon me, with that. So I like to run. I do some cycling, and that's it.
Cool.
And I'm old now, so I'm supposed to be weight training. So I've been trying that.
I can get behind that. I don't think you're old, but I can get behind the weight training thing.
Yes, so I am trying. Is that what it's called? Weight training. I do have strength. That's what I mean to say.
Yeah.
That has started.
Great.
When I turned 40. So
yeah, that's great.
Yeah.
Do you like running on the road or trail?
Used to be on the road only, and then COVID, and I purchased a treadmill. So now because of the hour in which I have to wake up and I don't like running in the dark.
Yeah. Fair.
That's where it's happening mostly.
That's good.
I have a dog who I love. I have a black lab, and I attempted to run with her. And that would help me to feel safer running, but that's not happening. She just wants me to basically hold her the whole time. So we're running on the treadmill. Yeah.
Totally.
Yeah.
Makes sense.
Yeah.
Let's transition to the last question is, what does like move local mean to you? So I like to ask everyone this.
Yeah.
It's not like what you think I want it to be.
I know. Yeah. Yeah.
More of like how you feel when you hear those words.
I think that this is going to sound really corny, and you'll only believe me if you know me. Like, I'm a huge community person, and I think that part of connecting with people and getting to, you have to connect and you have to know, and you have to like, okay, now I know your face and I know your clinic, and I know I'm going to refer to that place over there because I met the owner. One of the reasons I love Merit so much is because during COVID, not through buying beer only, but I would go in there all the time because I wanted all the places to stay open, right? So I think move local, we have to stay connected. And I think especially as healthcare professionals working in this arena, right? We're working in the private world. It's really easy to kind of isolate and exist in your own little silo. And it's always been really important to me to get out there and help to understand, okay, so if I'm going to refer over there, I got to get to know the people. And at the end of the day, I really like what you're doing in terms of, I think, supporting entrepreneurs who are really trying hard to do things authentically. I listened to, I think it was one of your first ones this morning with the person who, I don't remember her name, but the store on James or something. She was talking about art and the reason why she was doing art. And like these are things that are really, really important for people to kind of have a face behind what the various things are, I think it's really important. I think that people have to understand that we're human beings behind our businesses as well. That's a whole other conversation.
Totally. Yeah, for sure. Yeah, I mean, it's the big reason why we want to start this podcast is like when I came to Hamilton in 2020 when we opened our business, I was very blown away by the small business in Hamilton and Dundas and how unique and special some of the stories were and the things that people were doing. Like I was in London and I'm originally from like the Windsor area, and I was very taken back by the small business community here in a very good way. And that's what really made me want to start having conversations, because I'm like, how's no one doing this? Like there's so many good people that are doing such great things that people need to know more about, and like we need to support each other. And it's so cool to see like the connections after like having done, we're up to like 85 episodes now or something like that, like seeing the connections between the different people that I've interviewed, and like they know this person, they know that person. It makes me happy, because I'm like, this was all happening, but like to bring it more to light, I think is so important, and hopefully it connects like some of your community with our community, with Great and Grits community, with
100%.
And it's like the way that you keep the small business community going. So
I was looking on your page. I was like, oh, I just did a speaking thing with Alyssa from Darling Donuts. And she approached me a little while ago, and then the nutritionist that used to work with us, like her brother-in-law was on your podcast, because they're all local. Like it's great. So
I love that.
It's good that you guys are doing that.
Sweet. So if anyone wants to work with you or your team or find more about what you guys do, what would be the best place?
Our website. We don't have there's no secretary here.
Yes.
So, and we're always in session. So nobody's answering the phone. I do check the messages occasionally, but the best place is to reach out through there. Yeah. And I do try really hard to stay connected with some of the other local Hamilton therapists as well. So if we can't help you here, it's pretty important to me to help with that community as well.
Awesome. Yeah, I'll link the website in the show notes, guys. Awesome. If you're looking to work with Carly or learn more about her team, head over there, check it out. Thanks so much for your time. It's a great conversation.
Thank you.
Really appreciate it.
Okay.
And I'm sure we'll connect at some other point.
Okay, thanks.